Good morning and hello again. I will, in the interest of a lot of my presentation that has been really well covered so far around serialization, I may pivot a little bit, and it gives me the chance to also talk a little slower than yesterday. And so originally, I had structured this to introduce track and trace, but I think that given what we've seen so far, this has been exceptionally well covered. So really what I would like to focus on today, and we'll move through it, is around the opportunity that serialization, track and trace, data standards, and interoperability provide really for the opportunity for value beyond compliance and areas where we can see digital innovation in the supply chain. And I think to Volker's point, where we've seen other industries, and I've been fortunate enough to work in certain companies where having that end-to-end interoperability to be able to see inventory in real time within your own network, your own channels, as well as your third parties and downstream partners, really changes not just what you're able to do, but more importantly, perhaps how you're able to do it. And so part of what we can touch on is the shift of moving from a physical supply chain to a digitized, moving from a supply chain to a supply network, and then shifting from more manual processes to automation. And so perhaps shedding light where there's no dark after today, we now see over 30 countries or economies that have serialization requirements. And per a recent Advanco white paper, this now represents approximately 75% of global medicines. And so as we look at the background here, significant numbers of counterfeits kind of led us here, most notably in the United States economy, the 2008 heparin incident and Avastin in 2012. And so these requirements for serialization are now global in economies around the world to counterfeit, or to deal with the counterfeits that are now worth an estimated $75 billion, and as we heard from the WHO earlier, approximately 10% of global product. And so while the priority does remain on implementing serialization to protect patients and protect the supply chain, there's significant opportunity to change what and how we operate using interoperability to improve inventory visibility, forecasting, reverse logistics, and recall management. And so kind of recapping, what we really are starting out to do is focusing on prevention of having poor product quality enter into the supply chain, detecting those products when they do enter the supply chain, and then having a rapid response to be able to respond to these incidents as they occur. So I can probably bypass this as we've seen this in terms of how aggregation and the packaging lines work. But as I can speak to some of this, I started working in the serialization space in 2009 in the United States economy when we were really dealing with legislative requirements from California and Florida, and we were still using the term e-pedigree. And so much of what I had to do at that point to justify getting us to be able to have aggregation was to be able to build white papers and business cases to highlight to my executives to get approval to implement areas like aggregation and to be able to show and demonstrate potential opportunities for value beyond compliance. And so if we look at the building blocks that we see now with the GS1 data standards to be able to identify, capture, and share, what this really gives us the building blocks for are using the EPCIS data standards. What is the product? And so that gives us a lot of your GTIN information, your master data. What are the products? What are its attributes? Where is the product in the supply chain? When did it get there? How did it get there? Why did it get there? And so as we're able to have the data exchange of information for master data, transactional data, and event data, if we kind of look at the bottom through the end-to-end supply chain, this really should enable us as organizations and amongst organizations to identify at our most mature level where inventory is and where it sits in the supply chain. And so to recap a little bit about this, I touched on it yesterday, is there are a lot of demographics challenges, and I know this is a bit of an eye chart. But as we try to really address a lot of these, we're going to need this digitized supply chain to really help us develop and deliver more innovative care models to meet a lot of the gaps that we are going to experience. And so recapping, we have an approaching silver tsunami as a global challenge, increasing financial pressure, a growing shortage of clinicians, and a data disconnect, which I think is important to touch on, is that the rate of medical data in the world today is doubling every 78 days. There are various data standards, not just from GH1, but FHIR and others, and a lot of these data standards are not necessarily interoperable. Systems don't work well with one another. And so there's just a significant amount of challenges of connecting this data to turn it into meaningful information. And so assuming we are able to do that when we do reach a maturity point, it provides a foundation for a lot of innovation in supply chain. And I think to what Volker had just touched on, there are valid use cases where we can see today in retail, CPG, and e-commerce, much of the art of the possible of what we are or should be able to do in the healthcare supply chain. And so going back to what these 2D barcodes or QR codes can enable, having the visibility and coming out of COVID-19, we know our supply chains need to be more resilient. We saw firsthand how hospitals were dealing with not knowing where medical products were, not knowing where inventory was. And so by being able to have a digitized supply chain and know where our products are, allows us to not only build a more resilient supply chain, but build a more effective and efficient and effective supply chain. With that digital foundation, we can move to just having a vertically integrated or interoperable supply chain within an organization to being able to connect a network of supply chain trading partners, regulatory agencies, NGOs, and service providers. And by building upon that, we're able to shift much of our manual processes that we operate in today to automated processes, which build in additional resilience, efficiencies, and allow us to be able to operate with robotics, drones, and other advanced technology that should enable us to transform the healthcare delivery experience, much in the same way that many of us in the e-commerce or retail world have seen as consumers, as customers, the product experience for us as consumers changing, which in many cases at times feels like it may be a leapfrog ahead of where the healthcare supply chain has been. And so starting with physical to digital, the product is now being accompanied with a digital product data. So that should enable our interoperability and shared visibility across the network. And so from a supply perspective, we should be able to see our global inventory levels, their status, the serial numbers, where they are, lot, dating, traceability, et cetera. But with the interoperability, we should also be able to see this across channels. And so who are our partners? How are we integrated to them? And what information are we now able to see end-to-end through the entire supply chain into the network? And so the GS1 data standards are helping facilitate what we would normally see in certain concepts in retail, collaborative planning, forecasting, and replenishment. One World Sync is another good example we can look to in the retail and CPG world of being able to easily share standardized data amongst trading partners to improve data quality and reduce errors and help support master data management in addition to the transactional data to know exactly where our inventory is, when it got there, and how long it's been sitting there. And so I wanted to focus on this slide a little bit, from the physical to digital, because we're all consumers. We're all operating in a world where we're seeing convergence of technology, and particularly in healthcare, much was accelerated by the pandemic to drive digital adoption and innovative care delivery models. And much of this came and accelerated out of necessity. And so I'm sure all of us are carrying a smartphone in our pocket. You may have an Apple Watch on your wrist that is effectively a healthcare monitoring device. And so at this point, we all have medical products attached to our bodies in our pockets. And so we have these mobile health applications all around us and everywhere around us that provide us real-time access to data and information and our own health records and the ability to take more control of our own health care. we're wearing health monitors. And so when we look at the entire convergence of technology, artificial intelligence, machine learning, we have extraordinary capabilities now that we didn't have 10 years ago for data analysis, to the point where we're now seeing in medicine AI being able to better address certain medical conditions, certain types of cancers that it's able to identify before physicians do. But again, this goes to that growing level of data disconnect. But the opportunity to have clinical decision support be automated continues to allow all of us as consumers to take more control of our healthcare and be more informed and make more informed decisions. And so if we take a step back and we think of patients, perhaps not just as patients, but also as consumers, in the same way that retailers or CPG companies often look at their customers, and you think about the holistic product experience of receiving and delivering healthcare, it can serve as an illustrative use case of to what is possible, but particularly as many of you all in here have children, nieces and nephews, perhaps grandchildren who are much younger than we are, a generation younger also sitting in this room, that the expectations are also rising. And I can recall when we were starting up a pharmacy, getting a question with what I always thought was an interesting beginner's mindset, which was, I'm able to see a box of Air Jordans that I ordered from Asia, sitting in my office in Seattle 4 days ago, and I've been able to see every single tick along the way of where that sneakers went, from the time it arrived at the port of call to the time it moved to a distribution center, until the time it was on a truck 6 blocks from my home, all in a mobile application across various trading partners for a $140 pair of sneakers. But I can't do this, in some cases, for a $1,000 insulin product. Why? And so I think that was the right question for someone who had no healthcare experience to ask me, and candidly, I didn't have a great answer for that. And so that beginner's mindset and some of the learnings as Volker was building on that we can take from retail and CPG, and building on our data interoperability and supply chain interoperability, really should showcase to us the art of the possible, but also meeting our consumer expectations where they are today and where they will be looking forward to tomorrow. And so I was very, very fortunate to work in a vertically integrated organization where, while it was a perpetual challenge, I was able to integrate my inventory and warehousing and distribution systems with many third parties, be it DHL, UPS, DB Shankar, Maersk, and others, to have real-time integrated visibility across my network. And so not only within my own organization did I know where the inventory was, but I knew where it was in transit, and I knew where it was in the channels downstream. And so having that end-to-end integrated supply chain shifted from a supply chain to an entire holistic supply network. And so the term control tower gets thrown around a lot. And I think what really became most noticeable to me as we went through this was not just what we could do in a control tower model, but how we could do it and how the entire organization and the behavior of the organization had to shift. Not just looking at where our inventory was, dealing with quality assurance or ICQA issues, but being able to make decisions at a strategic level, a tactical level, and perhaps most importantly, within the operation. And so, yes, we were able to significantly improve our forecasting, planning, and being able to see demand signals, in many cases, achieving a level what we used to call hands off the wheel, where we had certain products and categories where human involvement in the planning, forecasting, and ordering process was virtually non-existent. Our systems had gotten to a point where the demand was so predictable, especially, and if you think about most medications or medical products, I'm on 2 medications that I will take for the rest of my life. I take a pill a day, and I get a fast-acting rescue inhaler because I'm asthmatic. Well, we know what the demand for that is going to look like. It's the ultimate subscribe and save model, the ultimate auto ship model. Every 30, 60, or 90 days, the medication is going to be mailed to my house. And yet we still carry exponentially more inventory in our supply chains. And I liked Volker's example of milk there, because as a medical product supply chain, we have shelf life of products that's typically around 2 years. And we still have the same rate of obsolescence as an industry as dairy, which has a shelf life of less than 2 weeks. And so the ability to be able to see that inventory and where it is and reduce obsolescence and waste and loss was significant. But what I thought was more impactful in a model like this was to take centralized decision-making that most of the healthcare and medical product supply chains that I've worked in or been fortunate to be a part of, we often had very centralized decision-making structures. All of the inventory went back to a headquarters or to a major hub or even a decentralized spoke. But there's a disconnect between the person on the floor of a warehouse or distribution center or a plant who in real time can see what's happening and the challenges that they have, but they may not necessarily be empowered to make that decision. Well, now that they have full inventory visibility or operational visibility to what's going on, rather than these decisions having to go all the way up the chain or go down the chain, the structure of the organization was able to be changed to a decentralized decision-making process. And so when I was operating or leading a building and something or an issue would arise or I needed to expedite an order, I didn't need to go up the chain to ask permission. It was expected and incumbent upon me to make the decision in the best interest of my customers and of my patients to get inventory and get product out the door. And so as we look forward to hopefully the art of the possible of a control tower structure, I think one thing that is very, very important for us all to keep in mind is that it's not just a strategic, tactical, or operational change that this should enable us to make, but an organizational change in terms of how we empower decision makers and our supply chain practitioners throughout the supply chain. And I think if we bring this back to the APEX Supply Chain Security Toolkit, it increases the importance of decentralizing that information, empowering our supply chain partners that are on the front lines in the plants, in the packaging operations, in the distribution centers, at the ports and in the pharmacies, to be empowered to make those decisions because they now have access to all of that data and information to make decisions in real time and not just make better decisions, but make faster decisions. And so if we look at that supply chain to the supply network and how we see this impact retail, and now we're looking at economies around the world, many of our incumbent organizations that we work with have had some dated and antiquated technology, but not just the technology. There's often been an expectation of, we do things this way because we've always done things this way. And so being challenged by many individuals who come from other industries or other backgrounds and having new incumbent organizations that in many cases just have more customer-centric operating models and better technology, these new entrants and non-incumbents that are entering the healthcare space are already capable and know how to deliver really a true omni-channel patient experience that is really, really difficult to have seen in healthcare as of to date. And so having that end-to-end visibility built on these GS1 data standards and interoperability has improved forecasting, capacity planning, the ability to purchase inventory, and as I referenced, kind of a hands off the wheel. The moment you hit a reorder point, you can free up individuals in your organization to have an auto reorder, to free them up to do more important work, in many cases focusing on your customers and on your patients. But more importantly, I was fortunate enough to be part of an Amazon program where they went to one-day delivery. And it wasn't so much as if you read in the media or in the newspapers, oh, we're working people harder. Well, first, we'd already been doing same day, within hours delivery before it was publicly announced. But it wasn't about working harder. It was making sure you had the right inventory in the right place at the right time for the right patient or customer to be able to fulfill that order just in time, in hours, or at most in 2 days, which is a level of delivery service that in most of healthcare we just haven't been able to experience yet. And so looking at models like that, building on the uniform data standards and having those data transmission capabilities, if we look at a Walmart, an Amazon, or other global leading retailers and CPG companies, as Volker was referencing, they're doing much of this already. And so how can we not just have them learn from us and how we are using interoperable data standards, how can we learn from them and bring much of these operating practices to deliver for patients? And so if we get into manual to automation, and I'll make this my last slide in the interest of time, I was fortunate to be able to attend some events and work in a space where building on all of this inventory visibility, data interoperability, was the ability to transform healthcare and delivery logistics, starting in Africa, if you are all familiar with Zipline, where much of that has been pioneered, but these delivery services are likely coming to a pharmacy or healthcare provider near you sooner than you would expect, with much less infrastructure than you would expect. And so right now with ChatGPT and AI and drones and delivery, we generally just look at the Terminator scenario of the drones that want to kill us. But I do think it's important that sometimes we think about perhaps the drones that would like to save our lives. And so we're already seeing Zipline, who has mostly pioneered their robotics in Africa, where today what we already know is that 5.5 million children die annually because we are unable to get the right product to the right place at the right time. And so drone delivery and addressing that from a good distribution practices perspective, a good storage perspective, making sure that we have the right transportation methods and that they're validated, those are all critical. And the supply chain security toolkit provides a great educational foundation for those decentralized operating models that we now see globally. But by being able to build on knowing where your inventory is, what's in it and what it can handle, those are the capabilities that are foundational to AI models, which most of these drones are operating on, to be able to enable that type of delivery. Not in days, not in hours, but in some cases now in minutes. With what we used to call dinner plate accuracy, meaning from about 45 feet, the drones that I was fortunate enough to kind of get to work with were able to drop a medical package into the space accurately, about the size of a dinner plate. And so as we think about that drone expansion for medical products, which is already significantly beginning in the United States, there's pilots already ongoing in Texas, in Arkansas, where they're already operating this from their pharmacies. And in the cases of Zipline, they are now able to install a drone operating model for medical product delivery on the side of a Walmart within a day. They're able to launch and catch these and bring them back in, but more importantly, by knowing what inventory they have, where it's going, and who it's going to, they're able to make sure you have the right product at the right place at the right time through the right route of administration. And so I think what's really, really important to think about too is Lee brought up the concept yesterday of equity in healthcare. And I think often we've thought about this type of capability for product delivery and convenience as perhaps a luxury for the wealthy. And for the individuals, no matter where they are or who they are, that need this healthcare, convenience isn't just a luxury, it's a necessity in making sure that I don't need to wait around for days or 3 to 5 hours for a delivery window. That if I can get predictable delivery in minutes, think about that, what that has the possibility or the potential to do for our patients, for adherence, for outcomes, for improvement, not just in traditional medical devices or drugs, but for diagnostics. Being able to have a drone pick up your sample and have it go to the lab prior to your doctor's appointment, only to be able to get through your doctor's appointment and have the test already completed. And the instance of Zipline, where they've already seen a drastic fall in Rwanda in maternal mortality because they were able to transport blood. If we look at much of those same concepts and we apply that to many of our own economies, the potential for delivery in 1-minute time windows is extraordinary. And so the convenience shouldn't be a luxury for the wealthy, but it's essential that those most at risk are receiving that same level of treatment. And so if we allow our imaginations to expand and think of what the art of the possible is by building on these data standards and inventory visibility, it's those capabilities that enable this level of delivery service and capabilities that is already happening today. This is already happening in Western Arkansas in the United States, courtesy of Walmart, and it's already happening in College Station, Texas today, courtesy of Amazon. And Zipline in particular has now partnered with, I believe, 34 different health systems and pharmacy partners in the United States, and they will begin delivery in 2025 and 2026 using this model. And so as we think about the supply chain security toolkit and the art of the possible and what these standards can do, it's very, very important, but also to keep our mind on how is delivery going to change? What can it enable, but what do we need to do as stewards of our supply chains to make sure that as we change and transform this model, whether it's centralized or decentralized or wherever it is, that the individuals that are executing these, who may or may not be true healthcare professionals, have the right education and the right knowledge to truly understand the products that they're handling, the criticality and the importance of these products, and make sure that they're maintaining the quality, security, and efficacy of the supply chains and protecting patients. And so I could touch on a few others, the value beyond compliance and the case studies from Strength and Unity that still hold true, but I think in the interest of time and because much of this has already been covered, I'll pause there and see if there's any questions.
Thank you. Okay, anyone has a question? Yes, all the way back there.
Hello, my name is Hun Sang-lee from Right Foundation Korea, which is a foundation supporting global R&D for improving healthcare access in LMIC for vaccine diagnostic and others. And previously, I have worked in Korean government aid agency, worked in Ghana and Rwanda, and actually I myself have seen the Jim Lion in action in Ghana, supporting like many of the supply chain needs. And my question is, it was really interesting to see how the experience for this kind of supply chain innovation in Rwanda, Tanzania, and Ghana in the African continent being translated back to United States, and then maybe adding to additional supply chain digitalization and advancement or innovation further. And I was wondering what might be your perspective on how those kind of experience from more of the lower and middle-income country resource-limited setting experience can be translated back to high-income country setting, and then back to some other additional geographic location like Asia-Pacific. Thank you.
No, it's a great question. I was fortunate enough to get to work on some of these and some different projects in the African economy. And I saw some of the EY literature cited yesterday. And when I was there, we did some of this, and we used to call that the leapfrog effect, in that we could go to a developing economy, and necessity is the mother of invention, is generally how we looked at it. And I also thought it was interesting in how at first much of these things turn out to be magic, and then you'd be working with different clients or partners. And when the drone arrived a minute late, now all of a sudden we have a really, really big problem, because their expectations, even in emerging economies, had shifted so drastically. And so I think what was really remarkable and the takeaway that I had from the opportunity to get to work with some of those organizations was that if you can build capabilities with such limited infrastructure in these environments, then in many cases there's really no excuse for why we can't do it in a wealthier economy. And so I think the biggest takeaway that I had from that was you don't need as much infrastructure or capital perhaps as you think you do. And I think the other thing that was really interesting about that and some of the experiences I had with different projects was we used to use the term be scrappy. And so rather than need a massive capital budget, here's a limited budget, go figure it out, go figure out how to do it and make a business case, and then when you need additional resources, all right, give me a good business case and come back and get it. But these developing economies didn't have that level of infrastructure. And yet they were still able to accomplish massive improvements and massive success. And so my biggest takeaway is if they're able to do that there, we don't have an excuse not to do it in wealthier economies. And then I think how that goes back to some of these economies in kind of the back and forth and a hopeful ping-ponging is that if we're able to take their learnings and their shared knowledge that they're sharing with us on how they're doing things back and learn from it here, then we should be more than willing and able to share what we've learned here and the technology that we've developed here and bring it back there to also tailor and address their needs and their use cases and build that into how our products and platforms effectively operate. Great question.
Thank you. Thank you, both of you. Well, Mr. Kelly, I do have another question I got. It says that for adapting a holistic control tower supply network model to the decentralized international public health sector, considering the varying levels of resources and constraints, do you see a public-private collaboration model as an essential factor for enabling a higher level of supply chain effectiveness? That was the question.
Yes, I do.
Okay.
I haven't been on the ground in many of these economies, but I've been able to work at least centrally with certain organizations. I live in the Seattle area of the United States where the Gates Foundation is present, as an example, and they've done outstanding work with distributing products, vaccines in Africa, and I think that public-private partnership is really necessary because the products that I might decide to buy, source, and use in a more advanced economy because I have more advanced or capable infrastructure may not work in an area where there be maybe more limited roads or limited storage and infrastructure for temperature controls. And so I think what's really, really important about that public and private investment, and particularly from the public investment and the public mechanisms, is making sure you enter this with a beginner's mindset and asking the right questions, in this case, working backward from the customer. Who is the customer, where they are, what do they have, and then how does their products get there? And if you haven't actually operated in that environment, you have no way of truly understanding what's going on. And so it's important to ask the dumb questions sometimes, but I think it's really, really incumbent upon those public organizations, whether they're government organizations or NGOs, to really outline who their target patients are and what their needs are and what the limitations are. That way, many of these private organizations are able to develop the right products and solutions that can most effectively address their needs. And so I think it's not just an opportunity, I think it's essential, it's a necessity.